today is the anniversary of our deadliest COVID day in Rhode Island. What have we learned in that time, if anything, as we see cases reemerging?
Well, I think we've learned a lot. I think we've learned that now we have a very effective treatment regimen. We have an effective vaccination regimen we didn't have back then. And hope we could get the more and more the entire population to vaccinate, now boosted. I think we do very well against it. So I think we've learned a lot. We know that masking and social distancing, even during times like this, also help prevent spread as we move indoors. We think we've become more resilient. Another thing we've learned is that the stress on the healthcare systems grows exponentially when we get these surges. So I think we've learned a lot since last year. I think we'll learn a lot more in the next year.
What does your hospital look like right now, Kent Hospital? We're hearing that hospitals are at capacity. We know we have a high vaccination rate, but we still have more than 25% of people not vaccinated, and that's the problem.
I think there are two problems. One is that, again, the 25% or plus that are not vaccinated. So right now at Kent, we're running in the 40 plus patients a day that are there. Also, this is on a backdrop where a number of patients have come in the past several months that sort of didn't get the care they needed during the pandemic. So we've been inundated, as have the other hospitals in the state. Rhode Island Hospital and Miriam have been the same. And at the height of our business, we were twice this. But at the nadir, we were at 10 a few weeks ago. So 40 creates quite a bit of a strain on a 200 plus bed hospital. Together with the staffing crisis we have, it's been very difficult, and the ERs are backlogged. So it's created quite a strain on us. So the message is everybody's got to get boosted. More people need to get vaccinated, and mask indoors whenever you can.
Is your ICU full up? I believe you have I spent some time in there, 8-bed ICU. That's a
15 bed.
15 bed. All of those can accommodate folks with COVID?
Yeah, so we have a 15-bed ICU and a 25-bed progressive care unit, which is sort of a step-down unit. I think as of last week, 8 of our COVID patients were ventilated, which is a lot. The ICU is pretty full. We had 17 patients in the progressive care unit. So about 70+% of these folks are not vaccinated or inadequately totally vaccinated. So it is generally hitting people unvaccinated more than others. Obviously, if you're vaccinated, the severity of the disease is less. So that's sort of the impact we have now.
And finally, let's just explain what fully vaccinated means. And some people are saying fully boosted because in the early times, January, February, the older folks were vaccinated. They needed to have been boosted by now.
Yeah, I think the term we use, fully vaccinated, they got their first series of vaccination, whether it be the 2-dose regimen from Moderna and Pfizer and a 1-dose regimen with J&J. Now you have to move on to the booster regimen. A lot of people have been boosted because they're 6 months from their second shot, right? So fully vaccinated, in my terms, is they got the first series. Now the booster is added on to that. But again, if people got vaccinated primarily a little bit late, they can't get the booster for 6 months, but their immunity should hold firm for those 6 months. So when we talk about fully vaccinated, I think we're talking about the first series of shots.
And you said 70% of the people hospitalized are fully vaccinated?
Are not fully vaccinated.
Not fully vaccinated. So that means 30% have been vaccinated. Are they not as sick?
They're not as sick. Generally, they're not as sick. That's true, but they have some illness. I can't tell you exactly how many days they stay in the hospital because I don't have that at my fingertips, but that's generally what's been playing out everywhere.
Anything else you'd like to add?
Booster, 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 mask, mask, mask.